Hello, my name is Patria Knowles, and I would like to introduce to you a policy for a new type of clinical trial for cancer patients. And who would this health issue affect? Persons or individuals with cancer. And what would the impact of this health issue on the community be? The impact will improve overall health and lower the mortality rate in adults and children with cancer. Well, why would this health issue need to be addressed? This is a chronic disease and an epidemic which needs to be attended to more effectively. America has been researching a cure and preventing measures since the 1950s. By utilizing clinical trials and exploring methods of healing while individuals have this disease, we can find an effective way to treat and possibly cure cancer. And who would be affected by this policy? In terms of treatment, all clinical participants would be affected, or persons with cancer willing to utilize cannabis treatment. As far as costs of clinical trials, ultimately, taxpayers for the costs and loss of business of big pharma promoting chemical usage for treatments. However, they may use this as a capital gains for new business. How will this policy address the health issue? Well, by expanding the use of cannabis without a green card permit and allow physicians to educate patients and promote the use of medicinal purposes for chronic disease, pain management, and possibly mental disorders such as anxiety. Cannabis is a natural compound which remedies health issues and does not leave adverse reactions to one's body as chemicals and poison does. Studies prove individuals with cancer and related health issues with severe pain or other chronic disease are active users in treatment. Also, respondents with prior cannabis use were more likely to believe that cannabis should be legalized, that it helped to treat nausea and it helped to cure cancer. Also, to date, two types of cannabinoid receptors, 7-transmembrane domain G, the protein-coupled receptors, have been identified in humans and other animal species. The CB1 receptor, initially identified in the brain, is found in high concentrations in areas involved in the processing of noxious stimuli. The CB2 receptor is predominantly located in cells of the immune system and likely has a role in the control of inflammation and cell proliferation. And clinically, I have observed that many cancer patients have benefit from adding cannabis to their pain regimen. The National Academics of Cannabis of Science, Engineering, and Medicine, the NASEM, conducted the recently published comprehensive review of the medical literature on health effects of cannabis and cannabinoids. NASEM concluded that there is conclusive and substantial evidence that medical cannabis is effective for alleviating chronic pain, chemotherapy-induced nausea and vomiting, and spasticity associated with multiple sclerosis. Existing cancer treatment is centered on chemotherapy and generally effective anti-cancer regimen that can add years to the lives of cancer sufferers. The issue that chemotherapy cannot target specific areas, so it is also kills a lot of healthy cells. This results in a host of serious side effects such as nausea, diarrhea, and significant weight loss and hair loss. Other existing therapies such as radiation therapy and immunotherapy also have major side effects and are currently very expensive, but what if cancer patients had a cost-effective treatment with minimal side effects that worked well alongside chemotherapy? Well, what will the change be by enacting this policy? I have 4 points. The perspectives through proper education, health, and quality of care given by physicians, and an integrating focus between Western medicine and holistic remedies. Number 2, it should restrict recreational usage and increase doctors' ability and knowledge. Having physicians receive proper training of cannabis to prescribe or encourage patients to utilize cannabis. 3, providing physicians with proper research and clinical trial data, and encouraging doctor licensures of medicinal cannabis. It will decriminalize, number 4, it will decriminalize medicinal cannabis and criminalize recreational marijuana as its seekers are only wanting to get high. Evaluate the impacts and the proposed policy. What are the costs and benefits of the policy? As it stands, medicinal cannabis may well disrupt the underlying system of cancer cells and prevent their reproduction or target cancer cells for programmed death, called apoptosis. This would not only offer a new treatment for cancer patients, but also provide a treatment that works in synergy with existing treatment solutions. However, to our knowledge, I have 4 points of costs to be looked at. They would be educational, medical, clinical, and treatment costs. And they are to be determined since I have no known research on them or seen any research. The 5 points of benefits would be pain management, medical treatment readily available for cancer and other illnesses, holistic approach with natural compound versus chemical compounds. Number 4 would be cost effective. Growers profit off selling cannabis and its components, approximately $5.50 to $8.80 per gram, equates to $35 to $72 million per 1 acre greenhouse. This means revenue could break even with costs. And number 5, reducing costs from licensures of an estimated $66 to $50 flat rate, no tax charge. And what would the risks of enacting this or not enacting this policy? Big Pharma would either go out of business or get on board and capitalize on this new big business to gain a profit. No risks involved with not enacting the policy. How would the lives of the people who are affected by the health issue change of this policy enacted? Individuals with health problems such as cancer will strengthen their quality of life and health and increase their mortality rate. What information about this policy would potentially affect the voting behavior of legislators from across political spectrum? Well, under the code principles of the ethical practice of public health, its intended use is that health professionals are to provide the least harm to a patient whom they are treating. Cannabis is a natural plant-based compound and it is least likely to cause harmful side effects if used correctly. Chemical compounds can cause heart attacks, strokes, renal failure, and many more. Cannabis has a natural healing compound, CBD, and can potentially cure cancer. What are the most important measures that the legislators need to hear about this policy? The pain and nausea relief cancer patients receive and their testimonials are well known. What we need now are human clinical trials to explore the effects of cannabinoids on cancer itself. Health benefits can come from using cannabis properly, such as treating cancer and how it's effective between the grower, seller, and buyer. How would the constituents of the legislators vote for this policy feel about the policy? The constituents' feelings would cover the spectrum of enthusiastically supportive to fearful and negative. And what information would a legislator need to sell the policy to constituents who were perhaps not in favor of adopting this policy? National Institutes of Health a government website publishes studies on effectiveness of cannabinoids. It is recommended that the legislator fully research the evidence that is readily available. Thank you.